So, Christian, thank you so much for joining me here today for this interview. It's such a pleasure to see you again. For those who might not have crossed paths with you before, how would you introduce yourself?
Well, first of all, my name is Christian. Some refer to me as Dr. Schulz Quach, but I actually like to go by the name Christian. Um, I'm a classic East Berlin, East German born, 79 born, German, um, globe-trotting wanderlust person. Um, by profession, I'm a cancer psychiatrist and a psychotherapist, but also a palliative care physician. And I think that's how I'd like to see myself, at the borderline between being a medical professional looking at the world from the perspective of symptoms and treating symptoms by interventions, and on the other hand, being a psychotherapist and psychiatrist who's using phenomenological inquiry and uh, therapeutic dialogue to understand better the experience of other people, often in situations where the experience is radically different from my own experience.
You see, I've been really looking forward to speaking to you because the majority of people that I happen to cross paths with, probably due to the nature of my training and what that attracts in colleagues, is people that are very much more into the not airy fairy, but the psychotherapeutic and the counseling. And so I rarely cross paths with someone that has, if any, clinical experience. Do you find that they are compatible?
I would say by the end of the day, everything can be compatible if you open your mind wide enough to allow ambiguity tolerance. Is that the right way of pronouncing it?
I think it is.
Ambiguity?
Yeah, yeah.
I don't know. Well, but we know what we're talking about. In German, it's Ambiguitätstoleranz. So the willingness to stay with conflicting information, often diametrically conflicting, going into very different directions, and staying with the unease of uncertainty which direction to get pulled into.
Mm.
But on a more precise answer, uh, I personally started looking into existentialism or existential philosophy or psychotherapy for this matter out of a very concrete pragmatic need that wasn't answered in medicine at the point, for me at least, and that was I was dealing with dying patients, I was dealing with end of life situations, and I just didn't have the tools to really provide a sense of authentic meaningful support that I knew I could provide, but I just didn't have the language for it. And so I turned to existential psychotherapy at this point, unbeknownst to me that there was a whole field and community of it. Um, and so in the early 2000s, 2005, I think I started diving more into it during my medical studies, and then realizing more and more how existential thinking is actually the lens through which I more and more shaped my clinical work and experience in palliative care and cancer psychiatry.
Mm. And so, how for you would you define existential ideas? And
So I'm not going to go and try to give you a highly impressive definition that nobody else in the world has been able to give so far. I think if I remember the new handbook on existential therapy has like a 4 pages definition of what existential therapy is and is not and includes is not. I'll give you a very, very basic, but for me, very helpful starting point. And that is that existential thinking deals with the fact of being, with the fact that you can even right now ask me a question about anything at all. That's for me where existential thinking and existential philosophy starts. It's at the very root of it, the fact that I can ask a question in the first place.
Mm.
Now, as you know, there is this famous paradigm that in existential thought, existence precedes essence. And so another short answer might potentially be, and again has been helpful for my own wrapping my mind around what existentialism actually is that existentialism is everything relating to the very immediate experience of my being alive at this very moment as I'm experiencing it. And that the very fact that I ask a question is already an attempt of moving away from being and existence, moving towards essence, concretizing it, specifying it, categorizing it, making it accessible to the structured system 2 mind, if you will. So that's my first starting point. But even as I talk, I can already see again, it's not that easy to define. But staying with the immediate experience in the here and now and trying to articulate the immediate experience as closely and as embodied as possible. I guess that's another component for me that's really related to existential thinking. The strong emphasis on the lack of a split between mind and body and the need to conceptualize existence as the very fact of a mind-body unity.
Do you feel that how do you feel that that has specific relevance to working with end of life patients? Because I can imagine some really, really tough questions being asked.
And you know what, true to what we just discussed in terms of embodied experience, I'm going to tell you that often it's not what's been articulated or brought into formulated thought that is really tough. What's tougher is often the unformulated, pre-verbal, embodied communication in suffering, in end of life, in symptom expression. It's what a patient or a person or a healthcare provider for that matter is not yet able to express in words, but is very much able to experience as an embodied relational experience in, for example, a situation of a patient being in acute distress of breathlessness or a pain crisis or severe overt death anxiety under the influence of the first two mentioned. It's those are situations where patient doesn't sit there and say, "Oh, as I contemplate my current state of being, I realize that death anxiety is creeping up upon me because my carbon dioxide levels are pretty high in my brain." But it's the ability to relate to embodied experience in the patient and myself as well in that situation, reading them in a way that is helpful and potentially symptom alleviating. I think that's where existentialism has been very helpful for me.
I would love for you to expand a little more on that, because I feel that not only is that relevant for that interconnectedness, that interfeeling, not only is it relevant for practitioners, but for members of communities, for families, for friends, whether with end of life or other challenges.
Mm. Now, a colleague of mine, Greg Medicine, and I hope you're going to interview him as well, if you haven't yet.
I have.
You know,
I spoke with him last week. Yeah, yeah.
right. Okay. Well, then there you go. So you'll know everything about focusing, and you'll know everything about the idea of the technique of focusing. But actually, I want to speak a little bit more of. I want to speak a little bit more about just perceptual awareness, and the willingness to endeavor to put whatever is experienced into words without knowing necessarily what the outcome will be, which is, of course, based in a very deep sense of trust and sufficient safety. When you speak to a person and you speak to something that is maybe just at the cusp of your own awareness, and you only start developing words for it or articulation of it, or even awareness of it, you need to really trust that the other person is willing to just sit with it and just be with it and not immediately judge it or brush it aside or devalue it or value it for that matter. And if you can find a space of communication in which verbalization is motivated, but at the same time not the only way of dialogue, then you enter a space in which you all of a sudden find a way of communicating with people who speak about experiences that you can't immediately relate to. Where all of a sudden you can communicate with someone who speaks in a foreign language. Quite literally, but also figuratively. And where you can start to communicate with patients who are so severely desperate and withdrawn that verbal communication is not a possibility to them, like a catatonic patient or a patient who severely withdrawn in a psychotic depression, for example. Not sure. Am I getting at what you wanted me to elaborate, or
It,
challenge me a little bit here?
yeah, no, indeed. I think it's just a very moving premise and a very moving concept to kind of sit with right now for me. But so I'm wondering, for you, having worked in this profession in this way, with that openness to connecting, to being with for so long, what impact do you feel that this has on you as a person, as a practitioner, as a human?
I would say what comes to mind just now is it's profoundly humbling. It's profoundly exhausting.
Mm-hmm.
And it is, and in this order, profoundly meaning making. But the meaning making, really, for me, I want to emphasize, because otherwise it would not be existential thinking from my perspective, is not the it's not the primary rank.
Mm-hmm.
It's a consequence of leaning into what I just described, and also being willing to go to places that can be overwhelming, can be at times unbearable to bear. Um, and run the risk of another existential metaphor of, not just looking down into the abyss, but being swallowed by the abyss because the abyss looks back at you. So, to put it into more practical terms, what has it done to me as a human being? I have certainly had situations in which I was so overwhelmed by, death awareness and proximity to mortality, my own grief, my own pain of of helplessness, of not being able to take away certain experiences from patients, or other human beings in this context, um, that it was quite unbearable. And in this situation, to be willing to communicate and articulate it, but also being willing to open up to other people supporting and helping along the way, um, was for me the only way of how I got through this. So I've been having psychotherapeutic support for myself for many years now. And I'm quite proud of it, to be honest. I'm proud of it because I have, from the very start of my professional life in palliative care, known that I am not an Ubermensch. I'm not superhuman. Um, I get um, you know, weighed down and desperate and angry and anxious, just like everyone else, as much as I can get very happy and very excited and sometimes, full of tears of joy. But I am a human being with all my limitations. And that also means that I need help and support. I can't just do it on my own. And I'm very grateful for the immense support, but also the immense growth that I have gained over the years from the several psychotherapeutic modalities and um, philosophical insight that I have gained through my therapy training.
I'm so grateful that you share that, and so coherently and so clearly and so honestly, because I think so many people, whether they are practitioners in our fields or whether it's just, an everyday person that I happen to cross paths with, they struggle so much to validate the emotional um burden of life, for want of a better phrase. We can totally justify, oh, I've gone on a really long walk and so my legs are tired, or I've carried a really heavy box and so my back is sore. This is easy to justify in my experience and many people's experience that I've met. But to justify and validate our own kind of emotional weight that we carry, I find people really struggle with that.
Yes, and it's natural. And it's to some degree maybe even good that they struggle with it. I mean, the very struggle itself is the existential challenge. It's giving you the choice of, approaching this struggle with a sense of bravery and courage, with the courage to be Paul Tillich, or to decide that you're not up for the fight and that you want to defend yourself against those questions and those discourses. And that's okay too. That's one thing I also take away from existential thinking. It is okay to be aggressively non-interested in discussing deep issues of life. It's not just okay, it is actually in some cases maybe desired. The important element here, however, is the choice, you know, that you can make a choice. I did this national discourse project on death. What does death mean to you? In young adults between the age of 16 and 24, and then together with my collaborator, Professor Martin Schnell in Germany, we did a follow-up project with professionals and experts in the field. But we didn't just ask them about their professional opinion or essence-oriented theories around death. We also asked them about their more existence-oriented lived experience of death. It was funny when we had these conversations that some of the death experts that we interviewed actually had a very negative and disinterested attitude towards death. But it was a choice after contemplating the matter, realizing that for them, really going into the lived experience of death proximity is something that is just too overwhelming and it's not perceived as healthy for them individually. And I found I found that a very interesting and helpful understanding of what it means to take an existential approach to life. As long as you're aware that you have a choice and that you are responsible for the choices you make, it is okay to have a negative attitude towards a certain topic that you don't want to explore. And to go back to my work environment, it is absolutely okay to fight with everything that you have for the very last seconds of your life and your very last breath. And no one can and will take that away from you. But it is just as okay to decide very early on that you never want to get involved in any form of treatment at all, because for you, your attitude towards life and death is a different one to that what medicine wants you to embark on.
For someone that might be struggling in the moment while they were watching this video, do you feel, or how in fact do you feel that existential ideas can help with their well-being?
Well, first of all, I would like to differentiate between a psychotherapeutic process and existential therapy as a therapeutic journey of, if you will, a two-person or multiple-person psychology, meaning that in existential thinking, um, in Heideggerian terms, Dasein, as a description of what it means to exist, always includes the other automatically. There's not just this one brain that has a defect, and that is why you're experiencing the world the way you do, and that is why I'm treating you now, and you're going to get better. Um, that's not a very existential way of thinking. So there's always already the context, environment, and others involved in how you perceive the world and you perceive yourself. That's that's a very important starting point for what uh, I want to say. Now, when we look at it from the Dasein's perspective and then look at other philosophers who've thought about this, and there is this difference between a psychotherapeutic process and philosophical thought. Both has the label existential, but I think they're actually very, very different. I think I already spoke to the therapeutic process before. If we talk about existential philosophy, then we're basically talking about essence. We're talking about someone having used their lived experience and the observed lived experience of others to formulate a concrete, specific idea of what it means to be alive and how we can put into words a system of understanding what it means to be alive, including suffering, including questioning life, including whether life has any meaning at all. All these are existential aspects, topics that have been discussed by many philosophers. Now, you asked me about those who are struggling. And a good starting point from an existential philosophy perspective for me as a psychiatrist would be Carl Jaspers, because he was a psychiatrist. And as a matter of fact, started off as a psychiatrist and was, when he was a little bit younger than I am now, he realized that that was not enough for him and that he didn't really find the answers he needed. And so he started to study philosophy and became a really eminent existential philosopher who at the same time created a descriptive phenomenology of psychiatric phenomena. And he also came up, and this is a long-winded answer to your question, with the concept and idea of limit situations. And that's one of the most profound concepts, philosophical concept that's been helping me in my work um, in cancer psychiatry, in end-of-life care and palliative care. The idea that human beings or beings in general have choices to make and have to go on their own path of meaning making, but we're all in this Dasein, in this embeddedness of the other and the context that we live in, already by the fact of our thrownness into the world, exposed to certain limitations that we cannot overcome one way or the other. And it's certain that we're going to be confronted with them. Fate, suffering, mortality, surprise. And what he says, and now I can't quote him word by word, but he says something along the lines of, when you're confronted with a limit situation, which basically transcends you, transcendere, makes you stand out, step outside of what you thought you are and your life is, then you're basically presented with the choice of finding nothingness and despair, or looking into and becoming open to what might present itself, although all security and certainty is gone. And that is what typically happens when you get diagnosed with a life-limiting illness, especially when it is at a point in your life where, from a life cycle perspective, you are not yet ready to conclude your life and to summarize, but where you might just be at the beginning of it, at recording a global interview series on existentialism, or starting a family. You know, I work with quite a lot of young individuals who unfortunately are facing life-limiting uh, situations, and in those situations, limit situation as a concept has been very helpful for me to maneuver how I communicate, but also how I understand the possibilities that are still available within the certainty of impossibility of a lot of future. I hope that wasn't too much.
Yeah, no, I mean, how do you do that to someone that is facing the end of their life, or a significantly limited life? How do you s- how do you enable them to confront this and face their opportunities?
Well, first of all, I'm not enabling anything, and I don't do anything in the first place, because it's already happening, right? The person is already faced with a situation. They're already in a choice situation. I might be able, I want to emphasize this, it's not always working, but I might be able to open a window of awareness that even in the most desperate situations, from an existential perspective, there always remains an opportunity for choice. Now, those might not be the choices that we typically think of, as in, do I want to eat yogurt or cheese, or do I want to meet my friends, or go online, or these might be much more substantial and essential choices about, am I going to start this treatment? Am I going to request medical assistance in dying? A form of end of life support that's available here legally in Canada. Am I going to intervene with a process that's ongoing and progressive, or am I just not going to do that? So I could go on, and sometimes the choices become very, very minute, you know? It's the choice of, am I going to look you in the eyes when I am with you? or am I going to keep my eyes closed? And making a vulnerable person in a vulnerable situation aware that there is still choice can indeed sometimes open an opportunity for dialogue, and an opportunity for the person to choose to engage with life, although they're surrounded by an almost all-encompassing sense of despair.
I imagine there's a sense that you have to be in the position to actually see it as a choice, because I know that we're seeing this theme of choice a lot in the field that we're studying, but and training, and but someone that isn't from this, someone that is just in that position and saying, what do you mean I've got choice? This isn't choice. This is not fair. This is completely unjust.
Mm-hmm. And I would not take away what you just said from a person who would speak to me in that way. That's why I've already made it clear that there's only the possibility of potential how can I say, engagement. A person or Dasein has the right to impose on themselves a detachment from Dasein, a not willingness to engage, a non-willingness to articulate, a rather intense, maybe even aggressive, even maybe violent clarification of boundary of what's verbalizable and what's not. And I don't want, that's something I've also taken away from existentialism, you know. Life is not clean. Existence precedes essence. Can be very muddy, can be very dirty. It can be very, very dark. But it can also be very bright. It can be very neat. And sometimes to the point of, you know, cliche, overemphasized caricature, funny. The whole spectrum is there. But going back to the more, I mean, sometimes existential thought is deemed to be too pessimistic or, you know, too nihilistic. Well, I can tell you that in my own career, when speaking to patients who really are finding themselves in a situation that's very hard to communicate and very hard to transport, this, if you want to stay with the labels, nihilistic approach has much often allowed me to actually communicate with those who felt that they weren't able to articulate themselves, that they were not in a position where they could be understood.
Existentialism gets a bad rep for being very, very dark, very, very pessimistic,
Yeah.
very nihilistic, but we find it can.
So maybe one thing I want to say about this, there is this notion of existential positive psychology, which is, by the way, comes from Canada, and one of our colleagues, Dr. Wong, is representing it with enormous passion, and I would say I would really support him in his endeavor. But I really believe very strongly that there is value in finding a disciplined and courageous way of really approaching the more muddy and more difficult and more non-inviting aspects of human existence into a dialogue as well, because those are the moments where we can really truly be of therapeutic support. Because again, if we believe that existence precedes essence, what that means is that a person will experience one way or the other. The choice they can make is whether they will essentialize it by putting it into words, or whether they will keep it as a highly private, intimate experience that they feel they cannot share out of humiliation, out of shame, or out of a sense of unformulated barrier, because the person believes that others would not be willing to hear. And that is what an existential attitude has helped me to not necessarily overcome, but to mitigate. A true sense of willingness to sit with and listen to sometimes very disturbing experiences.
For me, what's coming up also is this sense of uh, going with and accepting that muddiness, that darkness for the reality that it is. And I feel that humans are pretty good at denying it and resisting it, is the word I was looking for. Resisting that reality, resisting that muddiness, either for ourselves or for others. And I think that it can be really hard for people who are confronting something really, really dark, really, really muddy, when the whole world, like you said just there, are not willing to hear their reality, are not willing to really align and confront what their reality. Oh no, maybe it can be different, maybe it can be different. And sometimes sitting with that darkness and saying it's not different, but I'm trying to accept that, and I'm trying to make that choice to not resist it anymore, but see where it takes me, even if it's not where I would have necessarily chosen to go, can be incredibly valuable.
Mm-hmm. And interestingly enough, the very ability to create a safe enough environment in which those priorly unformulated thoughts can be articulated, or not just thoughts, but actually going back to what I said earlier, embodied phenomena can be articulated, paradoxically can create a sense of belonging and a sense of relatedness that didn't exist before. So the willingness to go into existence and articulation of lived experience radically within safe parameters and boundaries um, can create not just pessimism and nihilism, but by way of nihilism, if you will, can create a sense of meaning and belonging.
I'm very aware of the time here, but I wanted to ask one more question before you must go. You spoke at the beginning about having this wanderlust and having traveled, So picking this up, and you've mentioned Jasper's, but across your travels and across your experiences with delving into this realm of thought, for someone that might be interested in exploring these ideas apart from just textbooks, is there any other things that they can find these messages in, these ideas in?
Well, I'm really I'm really happy you're asking me this question, because there are indeed two things that come to mind. So the first thing I want to say is, although I can genuinely say I've traveled extensively, often with those who are really significant and meaningful to me, um, across cultures and languages, I have not had so far in my life a single conversation that I'm able to remember on death and dying that was boring. Even if controversial, even if very quiet, they were always meaningful, they were always insightful, and they were always creating a passionate sense of aliveness, again, paradoxically. So I would absolutely encourage anyone who's listening to this to to seek out opportunities to discuss death and dying. Two authors I strongly recommend, both of them interestingly died around the same time in the early 70s, wrote comprehensively about the topic of death awareness from an interdisciplinary perspective. One of them is well known in the existential world. It's Ernest Becker, who himself in his early 40s died of pancreatic cancer. And his most famous work, and a good starting point for exploring Ernest Becker, is The Denial of Death, an interdisciplinary analysis of Western thought on death. And that's also at the same time a limitation because it's mainly focused on Western thought. Another author who is not very well known, but who I found through my own little geeky hobby of seeking out old books on death and dying, is Jacques Couron, Chouron, who's written a number of books around the topic of death contemplation, death awareness, death theory. Both of them are highly accessible, highly readable, and highly recommendable authors who can be a wonderful starting point for exploring one's individual own disposition towards one of the many limit situations in life.
Well, I can't thank you enough for sharing your thoughts and your time here today, Christian. Before we close up, is there anything else that you wanted to add to the interview?
I felt very alive during our interview. And, again, I just want to emphasize this. It's an opportunity to discuss existential topics can actually be a very meaningful way of engaging in life and of feeling connected. And I thank you very much for this opportunity to talk to you today, Natalie.
Thank you so much. We'll speak soon. You take care, okay, Christian?
Thank you. Bye-bye.
Bye-bye.